in Oklahoma City back in the early 70s and the 80s and even the 90s. This area around First Baptist Church, it was very poor as a rule. It wasn't midtown by any means. Even though things have transitioned through the years, most of those people are still here, living very, very close by. So it's still quite a needy place when it comes to people that don't have insurance or don't have money to pay for health care.
I didn't have any place to go. I was on the street in Oklahoma City. You see, the only time I went to the doctor was if I was sick enough to go to the hospital, like if I had pneumonia or I just couldn't breathe at all. I've been to the emergency room, I don't know, probably 4 or 5 times before I came here. I've not been since.
Good Shepherd Medical Clinic and Dental Clinic cares for people in Oklahoma City that don't have medical insurance.
So we see those patients that nobody else is seeing. Good Shepherd is here all week long, and we're able to see patients on a regular basis.
Good Shepherd's history, for most of its existence, nearly 40 years now, it was just open a night or two a week and was a completely volunteer clinic.
We provided about 900 services back then. This year we're going to perform about 16,000 services.
We were fortunate to receive a grant from the Butterfield Foundation to build what you see here. And that is a full-time, fully functioning medical clinic, dental clinic, and pharmacy.
That grant is about to run out, and so we are in the process of raising money to allow us to continue.
Your health is a big thing. If it weren't for this place, I may not even be sitting here talking to you right now.
Our big concern a few years ago with the Affordable Care Act was that we would we'd run out of patients. Well, quite the opposite has happened. The number of patients calling for help has ballooned here and at other charitable clinics across the city.
These low-income uninsured are going out to the health marketplace and purchasing insurance, but their deductibles are huge and they can't afford their deductibles. So they're now getting into medical debt that they never had before. And then that debt is passed along to you and I when we have to go. Even though we have insurance and we're covered, it's raising the rates that you and I have to pay for.
Right here, we're able to see patients who are completely medically uninsured and don't have the resources to get medical care.
Our patients often have more than one job and work minimum wage, and so often when they're ill, they're unable to work, and that makes a huge difference in their ability to take care of themselves, their family, to provide their own housing. It's just a very, very important thing to have some access to health care.
When you donate to Good Shepherd, you are investing in those that live in the community.
These are our neighbors right here in Oklahoma City.
It's just an amazing place. They do so much good for people.